Drugs like Ozempic are prescribed to treat diabetes and also help people with weight loss.
But those drugs are expensive, and your insurance won't cover it if you use it for weight loss. Now, for more, we are joined by Dr. Timothy Quinn of Quinn Healthcare in Ridgeland. And Dr. Quinn, as always, thank you for joining us this afternoon.
Hey, thank you for having me.
I really want to ask why insurance companies are not covering Ozempic for weight loss when we know obesity is, is the leading cause of other health issues for people all over the country.
Right. Well, here's the deal. Ozempic, which is produced by Novo Nordisk, the pharmaceutical company, is FDA approved for diabetes. Now, the ingredient of Ozempic, which is semaglutide, is FDA approved for weight loss, but with the name Wegovy. Some insurance companies, but not many, will pay for the Wegovy for weight loss for individuals that don't have diabetes. But right now in the state of Mississippi, most of our insurances are not covering it. But surprisingly, Mississippi Medicaid pays for the weight loss Wegovy medication. Now, some of our Mississippi plans, such as Blue Cross of Mississippi, State Blue Cross Blue Shield, our United Healthcares, Aetna's, those that are in Mississippi are not covering it, but the federal insurances are covering it. It's just the way it is right now, but more insurances are hopefully going to pick it up as some of these indications are being discovered through research that these medications not only help a person get to a healthier weight, but there's some cardiovascular benefits which could result in that person's life being saved.
Yeah.
That's good.
Well, now, if you just wanted to pay for it out of your pocket, if your insurance wouldn't cover it, but you want to get Ozempic anyway, how much is the stuff?
Well, there are some saving cards out there, and I have some patients that are paying for it out of pocket. With some of these savings cards, you can get it anywhere from $800 to maybe $1,000. If you're just paying cash for it without the savings cards, then it's going to run you about $1,400 a month. But some people, believe it or not, are paying for it because to those individuals, they really want to get to a healthier weight. And getting to that healthier weight, they understand that not only do you look better, feel better, but you're healthier. And that's the most important thing. So as time goes on, we hope more and more of these insurances will start paying for it. But remember, the FDA description of the weight loss version of Ozempic is Wegovy, and Ozempic is FDA approved for diabetes. And if an individual has diabetes, there's a much higher probability that it will be covered. And a lot of those insurance plans that I noted are not covering Wegovy for those that don't have diabetes. If they have diabetes, is being covered as Ozempic. So, things are going to get better, but it's just going to take time.
Well, you've explained that quite well. And I think you've already answered this question that, of course, are the weight loss results worth the price if you have the money?
Most definitely, because as a doctor of 20 years experience, family medicine, and now board certified in obesity medicine, I have over the last 20 years seen so many patients get to a healthier weight. Patients that are living with obesity. I've seen those same patients have diabetes that's so much more controlled. Some not even need medicine anymore. People with joint pain, back pain, feeling better, dancing. People with hypertension, needing less medicine. Most importantly, in a lot of cases, avoiding those heart attacks and those strokes that would have been inevitable. Having their lives extended, but not only their lives, the number of years, but the quality of years. I have a grandmother right now that's telling me she's out there playing with her grandkids every Sunday in the park, and that's what it's all about, living longer with a better quality of life.
Now, since Ozempic is a diabetic drug, is the demand for people wanting it for weight loss, is that hurting the diabetic patients from being able to get it?
Well, that's something that's very, very well spoken or well known in the medical community, that a lot of the medicine is being diverted. Some people that might not need it are getting it in different ways that are hurting the market. Right now, there is quite a shortage. But the good news is Novo Nordisk, that produces Ozempic and Wegovy, they're in the process of opening a new manufacturing plant, and they're telling everyone that the supply is going to go up. So we're just going to be hopeful that we can get more of this medicine on the market. And then we have others such as the Manjaro that's produced by Eli Lilly, and they have a weight loss product called Zepbound that's very, very effective. So this is very new. These medicines are new, but the good news is they're working. The people are using it. People are benefiting, and more medicine is coming.
Dr. Timothy Quinn of Quinn Healthcare up in Ridgeland, we count on you to keep us healthy and keep us healthy safely. Thank you, sir. Appreciate you being with us today.